Hello and welcome back to the vlog. My name's Ed Hope. I'm a junior doctor in the UK, and as a bit of a recap, for the last 6 weeks I've been covering my experiences of the pandemic from a junior doctor's point of view, and it's been quite a hell of a journey. I've actually had my first week off last week, so that's why I didn't post anything, and it was really nice just to have a break from things, get back to, I guess, a little bit of normality as much as possible, eat some good food, relax a little bit. So it's great. I have such an amazing support network. People know who they are. So it's good to have that. But back to work today and actually raring to go. The date today is Tuesday, the 12th of May, and that's significant because this weekend Prime Minister Boris Johnson announced somewhat of a relaxation of the lockdown. Lots of people have criticise the ambiguity of some of the messages, but it is significant whatever, because we are seeing a reduction in the number of deaths. We are essentially past the first peak. The real concern now is what's going to happen going forward. We're in uncharted territory, although we can learn from other countries, and we are seeing, second waves, and we want to do everything we can to avoid that. This feeling of being in an unknown situation, I'm sure all of you can relate to. It's still an absolutely mad thing we're going through, but there are positives that we have dealt with this initial wave. I know regular viewers to the vlog will know that I've had the opportunity to discuss lots of my concerns and talk directly with some amazing consultants, particularly Dr. Steve Jenkins, a respiratory consultant, and Dr. Sonia Hudson, my boss, who I know lots of you are huge fans of the channel. So I'm going to catch up with Sonia tomorrow and Dr. Jenkins later on in the week. Also, I know at the weekend, Sonia did a podcast for The Times talking about what happens when someone goes on to ICU. So anyone interested in that, I'll leave a link down below. One of the things I wanted to mention that was really a big kind of concern of mine, I don't know really that it's being addressed, is that I feel like the government are putting out quite a positive message of where we are at the moment. Now, as I say, there are positives in a sense that we are in this now and we are seeing a decline in death rates, but there's definitely a discrepancy, I feel, about where we're at and the messages that are being put out by the government. Going back to my first video with Dr. Jenkins, the estimates of number of deaths from Covid-19 in the UK was between 20,000 and 25,000. Now, the government have been very sensitive about talking around these deaths. Clearly, each individual one is very tragic to the family and loved ones of those people involved. And the numbers, even from the first wave, are much higher. So we're over, I think, 32,000 deaths, which is a staggering number given the estimates initially. And I don't think I really understand why that is. Obviously, this is a complex answer that's going to have lots of reasons why they're higher, but I think one of the key things is, really, did we go into lockdown early enough? That being said, lockdown is only a temporary measure, and I think we're learning about how we can come out of that. The lockdown has clearly worked, and we're almost in a really difficult situation now about how we start getting back to normality. The economy is also directly related to people's lives. We need to have the world working again. It does answer the bigger questions, is our economy in general just rotten to the core that it can't survive, just a couple months of things stopping? That's a bigger question, but that's not going to get solved overnight. So we do have to face the reality that we need to start getting things moving somehow in a safe way as possible. The difficulty I have is the government are using quite kind of powerful language to kind of, I think, suggest that they're doing a really good job. I mean, isn't that the job of every government to kind of keep themselves in power? But, I think by all accounts, given their own numbers of deaths, there's been a lot to decide in their handling of this. And this sort of relates into what I want to talk about on the vlog today. So I've got a shift, I'm doing a twilight shift, which means I'm working 3 in the afternoon till 11 at night. And halfway through the shift, I'm going to talk about the clap for carers. So, the general public showing their support and encouragement and respect for the healthcare workers that are helping to deal with people that are sick during this time. On the surface, a very powerful and positive message that the public are showing sort of solidarity and support for healthcare workers. But you may be surprised about what some people in the healthcare sector think of this. And I'll talk about this halfway through the shift. Obviously, I've been up for a week, so it'd be interesting to see what the changes are in the emergency department today. And you can come with me on shift and I'll talk you through that. We'll learn about it together. But what I've heard from my colleagues is that the numbers are up again. So not in terms of COVID, but in terms of the people that are usually using the emergency department. So we're almost seeing a sense of normality coming back in the department. So that's probably a good idea that the ease of the lockdown has come at a good time. So we can learn about that all together. It'll be interesting to see how many patients have come in that have perhaps held off coming into hospital. I'm guessing we'll see a lot of presenting complaints of patient ill for 3 weeks, 4 weeks, 5 weeks, where usually in the emergency department we'd have, patients ill for a couple of days or a few hours. So that may be interesting to see, and that obviously doesn't bode as well. We like to see people as early as possible if there's emergencies. All right then, so I'm gonna get myself ready to go, and I'll check in with you as we crack on with this shift. So I've just rocked up to the hospital. It's 2:30 and it's first day back in for a week, and I am expecting it to be busier than it has been in the last month or so. So I'm just going to try and take it easy on myself, take my time with every patient I see, do the best I can for everyone in front of me. It'll be interesting to see what changes there are. We are seeing people with COVID, but also, don't forget, a lot of people can be asymptomatic with it as well. And the current social distancing, and I'm going to have to try and practice that as much as possible with patients. So limit my examination to things that are absolutely needed, reduce my risk of exposure. And that comes back into also using the personal protective equipment and washing my hands and doing everything we'd normally do, but being meticulous about it. I also, don't forget, still have another 5 weeks of this finger injury, but in the big scheme of things, it's not a huge issue. And to be honest, it's the middle finger, and I'm trying to spread the love, so using less of the middle finger at the moment. Also, if you remember from the last vlog, where's my light? I still have, can you see there, a bunch of Lego sets to give out. This video is not sponsored by Lego, but they sent Sonia and I like 240 sets that we've been giving out to the hospital. I think we only have like 20 left, and everyone we've given them to have been just loved it so much, and they really appreciate the support. It's funny actually how just a small gesture like that has such a big boost on things. That's one thing I really hope we learn as a hospital, just to spend some money, just small amounts of money, supporting little things. I don't mean with Lego, I mean in terms of things like we've been given very simple meals for free on night shifts. The kind of small things like that make a huge difference, and I think you get a much bigger payoff from the staff. Anyway, just like to bear in mind. Okay, I'm going to crack on with the shift. We're going to have a chat halfway through about the clap for carers and some of my thoughts around that. So I'm going to get into my scrubs, and we're going to hit the shop floor, and we're going to have a brilliant day, and we're going to smash it out. Every patient we're going to see, we're going to be really positive and make a really good job for. So I'll catch up with you halfway through the shift. So we're halfway through the shift. The time is 9 o'clock, and I've been on the red zone, so looking after patients with suspected COVID-19, but actually the majority of people coming in now within that area are people that clearly don't have a high suspicion of COVID, but they have many symptoms that could be put down to COVID-19, but after some investigations, and taking the history, we're finding that they're probably more likely to have other things, but obviously we've got a very high suspicion given we're still in the pandemic. So I'm actually seeing patients with more things like bacterial pneumonias and other infections, but they've obviously got fevers and shortness of breath. So that's why they're ending up in the COVID side. And because of that, we're obviously using universal precautions like all the personal protective equipment and isolating the patients when they come in. So it's a big change from 2 weeks ago, when the vast majority of people in the red zone, I would say, did have COVID-19. Not all of them, but certainly the vast majority. And now we're seeing that switch. So that goes along with what we're seeing in, being over the peak. The department itself is busier than we have been during this pandemic. I think people are coming in with the other problems problems now. They feel safer coming into hospital with those issues, but by no means as busy as would normally be at this time of year outside of a pandemic, which again may surprise a lot of you, but may also be, you know, for many reasons. One of them being people, you know, want to stay away, but we want to, you know, encourage people to come in if they do have any serious illnesses. I haven't really felt like I've been off for a week. Felt like I've come straight back into it. We've got a really good team on, which always makes a huge difference. Very cheerful, very positive team, and it's International Nurses Day as well. So big shout out to all the nurses, not just at my hospital, but across the whole world. Doctors often get put in the spotlight, but I think actually you guys would be astounded at how much stuff is not done by us. So much of that patient-centered work is down to the nurses, so huge shout out for anyone in that profession. One thing I wanted to talk about in this break was the clap for carers. So this is something that's happening in the UK every Thursday at 8 p.m, where the general public are standing out on their doorstep and doing a clap for everyone working in the healthcare profession. Now, the UK wasn't the first country to do this. I know Italy and Spain and many people across the world have been doing that type of thing. And it was only the week before last that I witnessed it firsthand, because I was off shift and came out on the doorstep and everyone was clapping. It was actually quite funny, because I think I just finished a night shift, because I was having a nap and I was like, what is that racket? And so I put my head out the window and realised they were doing a clap for carers. I kind of thought, you got to let them off that. So the first I heard about the clap for carers, I was actually on shift, and a bunch of my friends had recorded it on video and sent it to me over WhatsApp, and I sort of had all these videos coming in, and it was actually really moving. I'd never quite realised I'd have those feelings. Felt incredibly supported. I thought it was a very touching gesture by a lot of people. It may surprise you to hear that a lot of my colleagues don't really agree with that sentiment. And you might think, what? Why is that? I think the public in their hearts mean it as a good gesture, but I think given the track record of the NHS here in the UK, many of my colleagues in the NHS don't feel like they get the support from the government. And, you know, the government are voted in by the public, so ergo by the public as well. You know, things like, you know, MPs not voting on a pay rise in 2017 for NHS workers. Things like the junior doctor contract. So we went on strike a few years ago because we thought our contracts were being changed unfairly. Many of us, myself included on this, don't think we got the public support on that. I think the government kind of lambasted us through that and then declared it some kind of victory. I thought that was pretty inappropriate. And the nursing bursary that got scrapped, I think the government are looking to bring that back in. But even so, this kind of track record, even using the NHS as a kind of political tool during the Brexit with the big bus with how many millions, was it 350 million that we're going to get from the NHS there, to then have politicians and the public standing and clapping. Many people thought that was a bit of an insult. Many people thinking the NHS is here for the public, but where was the public when the NHS needed them? You know, with all this underfunding, and the staff really don't think they're getting the recognition and the pay that they deserve. I thought it was important for people to know some of the thoughts and feelings about how people really think about that kind of clap. But clearly the intention of the public when they come out and clap is that of support and love and appreciation of the dedication of people working in the NHS. So I feel like we need to take it for what it is and really use that to highlight how difficult it's been in the NHS in the last few years. I certainly feel like at times I haven't been able to give the care that people deserve. We need to take the positive intentions from it and really take that forward, and we need to learn lessons from this pandemic. Otherwise, you know, all those kind of lives lost, all those positive changes that we've seen in the NHS, all that, you know, real support from the public, you know, will all be wasted, and we can't let that happen. Right, so a couple of hours left on the shift. I'm gonna crack on and I'll catch up with you at the end. So there you go, another shift done on the red zone, so looking after patients with COVID-19, but even the last couple patients I saw clearly didn't fit the picture that we're used to. And I know it can present in funny ways, but you end up having a fair idea of what you're looking at. What was funny, one of the patients I saw actually knew Dr. Jenkins and said, you know, sung his praises, as many patients do, and said, had I seen Dr. Jenkins' COVID videos on YouTube? I thought, hang on a minute, do you not recognise me? Funny one. But overall, it was a good shift, really good team on. So yeah, feeling positive. I feel like I did a bit of bashing of the government earlier, but I think there's one thing you got to bear in mind, that it's a really difficult job for the government, and if there's one thing a doctor can empathise with, it's the idea that, you know, you get judged about things that people often don't understand. So a lot of the decisions you make, a lot of things you make are under a lot of pressure and a lot of strain, and so I can certainly sympathise with the government from that point of view, but I do think they don't really help themselves with regards to how the kind of stuff they put out to the public. That's just my view anyway. I kind of feel like they do tend to play politics with numbers and almost insult the intelligence of the British public. I've seen that with all the issues so far. Every time I hear politicians speak about it, I don't think they trust the British public to know the truth about what's going on in terms of everything, like the number of deaths that we talked about earlier, in terms of the PPE, in terms of the lockdown as well, just giving us information kind of they have it. I feel like the projections they're using, they have a much clearer idea of where we're going. They just don't necessarily want to tell us because they don't trust us necessarily knowing bad news. I feel like we're at a really critical stage now. We're through the first peak. People have kind of got used to, or kind of adapted as much as possible to a life, you know, with this coronavirus around, which no one would have ever thought about really at the beginning of the year, even though many people would have predicted this type of thing happening given what happened in China. But many of us are feeling the strains, both financially, socially, psychologically, with everything going on. And we're really just at the beginning. Fair enough, we've hit the first peak, but is the second wave going to be worse? Is it going to be easier? Is there going to be one at all? I think we all expect some kind of second wave, and it's really, again, up to the general public how well we can respond to things. And that ambiguous government advice about staying alert. How can you stay alert at something that's basically invisible to the human eye? Like, where is it? I'm pretty sure some patients admitted today with COVID-19, you know, how could you be alert to, you know, stuff that's just floating around in the air, that could be floating around in the air. Also, in lighter news, the Lego got snapped up today. Loads of people showed me like videos and pictures of their little ones opening the Lego and playing with it. So that was a really kind of special little thing to happen on the shift as well. So anyway, I'm going to wrap the vlog up there. Thank you again for all the support on the channel. I had loads of people message me asking if everything was all right, because I was sort of, you know, having a relaxing week, and yeah, everything's fine. I had a super week. I hope you guys are managing to get some respite as well. You know, it's important to look after yourselves in this. We got to, you know, look after each other, but don't forget to look after yourselves. And if you do need help, you know, trust the love and support of people around you. All right, guys, I'll see you soon.